Hi guys, Nash here. I want to say a few words about training after COVID-19. If you've seen my previous video, you probably remember that I had the virus and I spent 10 days in the hospital. The symptoms were quite serious, and I was on oxygen and antibiotics and corticosteroids. But then after 10 days, I went out of the hospital. And in this video, I want to say a few words, as I mentioned, about training after COVID-19. So bear in mind that this is my experience. This is what I've done. So that doesn't mean that you should do the same. Obviously, everybody is different, and symptoms they are very individual. There is no rules when it comes to COVID-19. So consider this video as my own experience. Maybe use it as a guidance, and maybe you can employ a few of the principles that I've done to benefit your recovery. But again, bear in mind this is very individual, and you need to be very careful. You have to be very sensible when it comes to training intensity and training frequency. So what I've done, I started training 4 days after I left the hospital. My symptoms allowed me to, they were not that severe, so I felt maybe 60% of my best, of my maximum, and training was very light. I started with only few sets per exercise, maybe 3 to 4 exercises, around 10 reps. The weights that I used were probably around 60% of my usual weights. So my goal wasn't to to repeat my best training sessions from the past, but rather to improve my circulation, get back to mobility, get a bit of feeling in my muscles. I want to say that I lost about 6-7 kgs in the whole process, so I was much lighter. My strength wasn't the same, but I decided to do a bit of training, so to start getting back into my normal shape. So the first week after COVID-19, after I recovered to come out of the hospital, I've done 3 sessions. The second week I done 4 sessions. I can tell that the weights went up a bit, the feeling was much better. I started getting better pump, and week 3, which is this week now, the weights went up again, so I'm probably around 75%, maybe 80% of my normal weights. I'm training 4 times per week. I'm going for pump. I'll probably put probably 3, maybe 3.5 kgs back. Feel much better, and I hope next week I'll probably get even around 80%, maybe 85% of my normal training routine. What is the most important thing to pay attention to is to make sure that you don't suffer too much from tiredness and exhaustion, because if you are tired and exhausted, then there is no point in training. Make sure that your rest between the sets is a bit longer than usual. So if you're usually resting a minute, make it 2, make it 3 minutes. Doesn't really matter at this point. And also, if you're short of breath, be careful, because in the beginning, my first sessions, I had to rest about 3 to 4 minutes between the sets, because it was quite difficult breathing. So yes, use this advice as a guidance. Start slowly, go for the pump, go for the feeling. It's all about circulation and mobility. So you want to get back into your training. You want to jump into the 100% intensity and do your best sessions as you've done in the past. So take your time, be sensible, and make sure that you feel good about yourself. So hopefully 4 to 5 weeks and you will be back. And in the next video I'm going to talk to you about eating after COVID-19. Until then, take care of yourself.